All right, everybody, welcome back. Thank you for joining us again. We're part of the Really Cool Humans Network. I'm Dr. Casey Oliver, and usually I have Dr. Hatch here, but today he's inside the chamber. We're going to talk about hyperbaric oxygen therapy today. Say hi, Dr. Hatch. So, this is from OxyHealth. This is the Viteris 320 hyperbaric chamber that we've been using since January this year in 2015. Now, with hyperbaric oxygen therapy, this is pretty much basically our guidebook. This is written by Dr. Harch, and he's one of the leading doctors when it comes to hyperbaric oxygen therapy. He's out of Louisiana State University, and this is an awesome book. So we talk about the oxygen revolution, why we might use this piece of equipment in our office. Dr. Hatch is in the bag. As you can see here, this is completely full right now. This is one of the portable units. When we talk about hyperbaric oxygen therapy, there's acrylic units, there's full rooms that are used as hyperbaric oxygen therapy. But this, as you can tell, is a Viteris. This is the 320. This bag will go upwards of 4.2 psi. And so that's basically like you're simulating a scuba dive at about 15 feet below sea level. And so you might be asking yourself, well, why is this important? Why would we even do something like this? As you read in the book, if you were to grab this and kind of flip through it, what you learn is that this was something that was used a lot with actual scuba diving. And so when they were helping people, for example, that were working on oil rigs or something below the sea, and as they would come up, these guys were getting the bends and stuff like this, so they would use hyperbaric oxygen therapy. And once the scientific world kind of jumped in and investigated a little bit more about why this might be important from a medical standpoint, essentially what we're doing is we use an oxygen concentrator here and pump the oxygen into the unit, and we're using oxygen as medication essentially. You know, obviously we don't prescribe medication, we're using oxygen. And this is a really, really cool unit that we use. And let's ask Dr. Hatch actually, how do you feel when this thing fills up? Talk to everybody about how you feel when you're actually in there.
When you're in the chamber, it's incredible. The only thing that you feel is like when you're diving, you feel pressure in your ears. And so you just clear your ears with opening your eustachian tube by opening your jaw like you would when you're on an airplane. It's the exact same feeling. Or if you're going down swimming to the bottom of your pool, you're going to feel that pressure and you clear your ears. That's the only thing that happens. Once your ears equalize, it feels as normal as it does outside this chamber. This chamber is about 3 feet in diameter. There's plenty of space. You can actually fit 2 adults in here. But there's plenty of space, and it's great. You feel the oxygen. We have the mask here that we can just breathe into the whole time, receiving that higher concentration of oxygen. And then this pressure, you only feel it as you're getting, and it's so incremental that it's very small, and it's really nice. It's nice to be able to take a bit of time. We have you dive in here about an hour. And you get to lay in here and you can close your eyes and you can sleep in this high oxygen enriched environment. And the benefits are just where to begin.
So there's a few contraindications, meaning these are reasons why we might not put someone in the chamber. If you've been diagnosed with optic neuritis, if you have a head cold, for example, and you're really mucousy or having a hard time clearing out any snot, spit, stuff like that. Another contraindication to putting someone in here is if you've had any lung condition or lung pathology, where there might be cause for concern with pressure changes. Once the pressure equalizes, these 2 little valves here on the back are letting air out, and the chamber will rest at 4.2 psi, and as the oxygen comes in and what comes out here. And it's basically just like you're sitting in this room. And so a lot of people will jump in here with an iPad or an iPhone or something like that. If it's not an iDevice, it's something else, a book. And most people actually like to jump in and just take a nap. While you're in the chamber, it's very important to make sure that we don't wear anything that has metal on it or that might cause a spark. Any devices that have a removable battery, for example, that might cause a spark. We're going to make sure that you avoid putting anything in the chamber that might cause a spark, because it's a very oxygen-rich environment. We just want to make sure that we're not causing any harm to the patient as they're in there.
So you might ask yourself, why not just sit outside in the normal environment and use the mask? Well, we're at a certain pressure, and the pressure, what the ability of the pressure does is while you're breathing in oxygen, you're getting oxygen to the tissue of my hands and feet. This is really good for diabetic wound neuropathies on their feet. Is you're getting oxygen via the bloodstream because of the lungs. Well, in the chamber, there's ambient oxygen in this air, and the pressure is pushing it actually through the tissue cells themselves. So those with like big bacterial infections in their lungs, getting oxygen down there where these bacteria can't thrive, you can help out these these different struggles with breathing in lungs, or inability to expire enough air or breathe in enough. I'm getting in oxygen, but I'm also using pressure to push the oxygen through the tissue into the deeper cells. The reason why we love the lower PSIs is because it's better for tissue healing, of ankle sprains, shoulder surgeries, any skin facial reconstructions, and those type of surgeries can heal the tissue a lot faster, because every cell in your body needs oxygen, stimulation, and fuel. And this is a way that we can get oxygen into your system much faster than just using your normal lung and circulatory system of your blood. This can push it into areas that haven't get it. Like instance, for a stroke patient or things such as that.
So Dr. Hatch just spoke on, obviously, how this actually is working and how oxygen is used as a therapy, how it's pushed out into the tissue where usually we have a harder time possibly getting oxygen out to the tissues. I'm just going to hit some of the contents here with Dr. Hatch's book, some of the other uses for hyperbaric oxygen therapy. So he divides this book into 3 different parts, part 1, part 2, part 3. So when we look into these chapters, you can answer a lot of questions like, for example, would this be something for me? Like, why should I be aware of hyperbaric oxygen therapy? Is it something that could be useful for me in the condition that I'm currently in? Oxygen deprivation, the body's inflammatory reaction. He goes over the current uses for hyperbaric oxygen therapy. Traumatic brain injury. Okay, it's actually right here on the cover. He has lists all these different conditions that this is so beneficial for. Traumatic brain injuries, other medical emergencies, birth injuries, cerebral palsy, stroke, autism, Alzheimer's, Parkinson's disease, other neurological disorders, diabetes and cardiac disease. As we go through, we're looking at joint replacements, arthritis, bone remodeling. He even touches on AIDS, asthma, alcohol abuse, and other uses for HBOT. And chapter 12 is HBOT as an anti-aging tool. There's just so many uses and applications for oxygen therapy. I can tell you from our experience clinically, most of the patients that we put in here have been in, like for example, personal injury cases through car accidents, where these patients might have suffered from a mild traumatic brain injury or concussion, chronic headaches. I mean, you name the condition. He goes through here, and I find it kind of funny. He goes through and he says, this isn't a cure-all as far as addressing different issues that most people deal with, and then he'll go on to explain the benefits of HBOT with pretty much every condition that you can think of. So now that this is decompressed, what we're going to do here is I'm going to zip Dr. Hatch out. All right, come on out. How was it?
It was wonderful. You need to come get a dive.
Thank you for joining us again. I'm Dr. Casey Oliver.
I'm Dr. John Hatch, and we're the Neuro Clinic. Please check us out on theneuroclinic.org or call us here at 801-766-6580. Thank you.
See you next time.